Good afternoon, and thank you for joining us. Today is Tuesday, February 8th, and on today's briefing, we'll hear from Mayor Cavalier Johnson, Dr. Ben Weston, Associate Professor with the Medical College of Wisconsin and Chief Health Policy Advisor with Milwaukee County, and Dr. Fatima Ali, OBGYN and OBED Director with Ascension St. Joseph Campus. Thank you all for being here, and Mayor Johnson, I'll hand things over to you to get us started.
Thank you so much, Catherine. Good afternoon, everyone else. Last Thursday, the Milwaukee Health Department launched its vaccine incentive program, offering a $100 gift card on site for anyone 5 years of age or older receiving their first dose of the COVID-19 vaccine at any health department clinic. As of this morning, there were just 90 gift cards remaining. I'm glad to see that the incentive program has been a success. For the 1,000 gift cards that were handed out, we will not have an additional 1,000 residents vaccinated against COVID-19, the virus. And that's when for our community, or should I say, we would not have had an additional 1,000 residents vaccinated against COVID-19 had we not done that. And so that is an update on our COVID-19 gating metrics for the week. We remain in the extreme transmission category for COVID-19 cases per 100,000, down to 222 cases per 100,000. And our percent positivity rate is down to the substantial transmission category at 9.7%. Our percent positivity rate has not dropped below the extreme transmission category or the 10% mark since December 2nd of last year. 62.6% of City Milwaukee adults, those are individuals age 16 or older, are fully vaccinated. 67.9% of adults have received at least one dose of a COVID-19 vaccine, and 43.9% of residents in the city, adults in the city, are fully vaccinated with a booster. Overall, our daily testing volumes have continued to fall since our peak in early January. We continue to see numbers lower for the disease in our community, and that's a welcome sign after the holiday surge that we had. It's my hope that we continue to see these numbers drop further in the coming weeks. The Milwaukee Health Department continues in its partnership with Milwaukee Public Schools to provide vaccines to students, staff, and the community through mobile clinics. The first round of school-based clinics will conclude today. And so far, the health department has administered 690 doses of vaccine. The schedule repeats Wednesday with second doses of vaccines offered at the same school locations. You can find the full schedule of clinics at milwaukee.gov/COVIDvax. Here's a brief summary of mobile vaccination clinics for this week. So today, February 8th, from 1 to 4 p.m. at Hopkins Lloyd Community School. Wednesday, February 9th, 1 to 4 p.m. at Alexander Mitchell Integrated Art School. 1 to 4 p.m. at Ascension All Saints Family Health Center as well. On Thursday, February 10th, 1 to 4 at Morse Middle School. And then on Friday, February 10th, from 1 to 4 at Clement J. Zablocki School. Dr. Weston is going to talk about boosters coming up. And yesterday in the internal briefing, the Milwaukee Health Department's medical director reinforced just how important booster shots are for protection from the worst consequences of COVID-19. If you haven't yet and are eligible, please go get your booster shot. Vaccines and boosters are always available at the health department's community locations at the Northwest, the South Side, as well as Menominee Valley sites. Finally, in my State of the City remarks yesterday, I highlighted the great work that health professionals are doing to address COVID-19 in our community. For 2 years, we've asked so much of the medical and public health communities. Consistently, the people involved have stepped up and they've delivered, and I am eternally grateful for this. And speaking of one of those folks, let's pass it off to Dr. Ben Weston.
All right, thank you, Mr. Mayor. Good afternoon. First, to our numbers, we're currently seeing in Milwaukee County an average of 312 new cases per day and about 5 deaths per day. Overall, our trends are moving in the right direction. We're seeing declines in cases, in positivity, hospitalizations, and finally in deaths as well. Our positivity rate remains high, so we should remain cautious with masking and distancing, but it is trending down nicely, certainly moving in the right direction. And in the next 2 weeks, we would anticipate being in a much better place with our disease burden throughout the county and the state as well. Now, today I wanted to talk about a population that is particularly affected by the pandemic, and that's folks who are pregnant or planning to become pregnant. Many see the vaccine as an unknown, but it's actually quite known and quite studied. The effects, the risks, and the benefits. Now, with regard to COVID and the vaccine, if you're pregnant or planning to become pregnant, there's two key questions to ask. First, what effect will the COVID vaccine have on the likelihood of getting pregnant and having a successful pregnancy? And second, what effect would COVID disease have on the likelihood of getting pregnant or having a successful pregnancy? So let's start with number one, the effect of the vaccine. Now, from looking at and studying thousands of women, we find the vaccine does not affect your likelihood of becoming pregnant. For women and for men, for that matter, the vaccine does not affect fertility at all. And once you do become pregnant, the vaccine itself also does not affect outcomes of pregnancy. Again, looking at thousands of pregnant women, when comparing those who were vaccinated to those who were not, those vaccinated did not have worse outcomes in pregnancy, particularly when looking at rates of miscarriage. The bottom line is that the vaccine is safe, whether you're planning to become pregnant or you're already pregnant. But then we have to go to question two. How does COVID disease affect fertility and the likelihood of a successful pregnancy? Now, on the first note, a woman's fertility does not seem to be affected necessarily by COVID illness, but the same is not true for men. COVID infection was found to decrease a man's fertility, at least in the short term of a couple months. And when you do become pregnant, the story changes. In multiple studies looking at thousands and thousands of women, those who tested positive for COVID had an increased risk of many poor outcomes. Far too numerous to list here, but they include preeclampsia, early delivery, postpartum bleeding, blood clots, and fetal distress. So we circle back to our key questions. Question one, does the vaccine have a negative effect on fertility or pregnancy? Looking at thousands of women and men, the answer is clearly no. But question two, does COVID disease have a negative effect on fertility and pregnancy? In both cases, the answer is clearly yes. But don't just take it from me, take it from the studies that I've cited. I've posted them on my Twitter account at Ben W. Weston to review on your own. Or take it from the American College of Obstetrics and Gynecology, our country's leading group of physicians caring for pregnant mothers. Take it from Dr. Ali, who will speak shortly and share her own experiences with patients. Or perhaps most trusted of all, take it from your own provider, the OB or the family doctor, the person that you trust to guide you through your pregnancy, to ensure that you and your baby are safe and healthy. Ask them for their opinion and trust them. They've trained for many years to be where they are. And when they talk to you, they have one interest in mind and one interest only, and that's you. Thank you and stay safe. And I'll pass it to Dr. Ali.
Thank you, Dr. Weston, for that introduction. Hi, everybody. I'm Fatima Ali. I am the director of the OB Hospitalist program at Ascension St. Joseph. And I'm here today to talk to you about the importance of COVID-19 vaccination in pregnancy. So according to the CDC, only about 42% of pregnant women have been vaccinated against COVID-19. And vaccination rates vary markedly by race and ethnicity. Vaccination coverage is lower among Hispanic or Latino pregnant women with a vaccination rate of 38% and among Black pregnant women with a vaccination rate of 26%. Pregnant women are at higher risk of getting severely ill with COVID-19 and at an increased risk of adverse pregnancy outcomes. So these adverse outcomes include things that Dr. Weston has already talked about, an increased risk of preterm birth, stillbirth, hypertensive disorders for pregnancy, ICU admission, the need for mechanical ventilation, admission of the newborn to the NICU, and unfortunately, death. Cases of COVID-19 in symptomatic pregnant women have a twofold increased risk of admission to the ICU and a 70% increased risk death. Vaccination is by far the safest and most effective way for pregnant women to protect themselves and their babies. Vaccination can occur in any trimester. To maximize maternal and fetal health, vaccination should be administered as soon as possible. What our data shows, and what Dr. Weston has echoed here, is that there is no increased risk of infertility, miscarriage, or birth defects associated with COVID-19 vaccine. COVID-19 vaccines consist of messenger RNA, and they utilize the body's own cells to generate the coronavirus spike protein, which stimulates immune cells to create antibodies against COVID-19. These mRNA vaccines do not alter human DNA in vaccine recipients. And as a result, mRNA vaccines cannot cause any genetic changes in mom or baby. I was pregnant during the pandemic, and I had my baby 10 months ago. I was faced with a really difficult decision as to whether I would get the vaccine at a time when there was far less information available regarding the safety of these mRNA vaccines in pregnancy than there is now. I researched the topic, I spoke with my physicians, and I made an informed decision to get the vaccine during pregnancy. The antibodies that were generated in my body after vaccination were passed on to my baby through the placenta, and it protected her from COVID-19 in the several months after she was born. I had a healthy baby girl at term, and she's doing great. I'm really happy with the decision I made with my physician, and I know I did everything I could to protect my baby, my family, and myself during this pandemic. Working in our obstetrical emergency unit, I've seen some really sick pregnant women coming in requiring ICU admission due to severe illness from COVID-19. It is absolutely heartbreaking to see these women and their unborn children struggle for their life. We have so much data now to support the safety and efficacy of these vaccines for pregnant and breastfeeding moms than we did before when I made my decision. And for this, I am so grateful. Pregnant women should contact their physician right away if they have symptoms of COVID-19 or have been exposed to someone with COVID-19. There are some treatments that may prevent severe disease when given as soon as possible after diagnosis. Ascension and several other hospital systems in the area offer monoclonal antibody treatments to pregnant women with mild to moderate COVID-19, as pregnancy is a condition that puts individuals at risk for clinical progression to severe disease. Now, I understand this is a difficult decision for women, and they must make it in order to protect their children and their families. They're cautious about what they're putting into their bodies. I want these moms and moms-to-be to know that here at Ascension, we support you. We're here to help you make an informed decision. We will work with you on your care plan for your health and the health of your baby. We support the CDC, the American College of OBGYN, and the Society of Maternal Fetal Medicine's recommendations that all pregnant and lactating individuals, along with those trying to get pregnant, be vaccinated against COVID-19. Thank you for letting me speak about this today, as it is a topic that I am very passionate about.
Thank you, Dr. Ali, for joining us, and congratulations on your daughter.
Oh, thank you.
All right, so we will now move into the media Q&A portion of our briefing. I see a few questions in our chat. So our first one is coming from Gabrielle Mays with Fox 6 for Dr. Weston. She says, you tweeted about the people and their mistrust of doctors during the pandemic. What are some of the repercussions you've seen from this?
Yeah, thanks for the question. I'll say I've seen thousands of patients. Dr. Ali has seen thousands of patients, and each of those patients has trusted us over years and years. They trust us to determine what their illness is, how to manage their illness, what medications to prescribe, what procedures are needed. They've trusted us at times with their lives to determine what is best for them or their families. And I think what's important is nothing in that relationship has changed. When your doctor looks at you and decides how to treat you, they have one interest in mind, and that interest is you. And that hasn't changed. What has changed is the trust that some patients, I don't think most patients, but some patients have in their doctors when it comes to COVID, when it comes to how to treat COVID, when it comes to how to prevent COVID through the vaccine. But I think what's important is to remember that that relationship has not fundamentally changed, and you can still talk to your doctor about anything. And one of those things includes how to protect yourself and your family from COVID and how to treat COVID should you be unlucky enough to get it. So I think continue that trust relationship, continue to feel comfortable talking to your doctor. And as far as what the implications have been, I think the implications have been many, many thousands of preventable deaths, many, many thousands of people hospitalized with COVID, and many, many thousands of people laid up at home with severe disease from COVID because they chose not to get a vaccine that if they had talked to their doctor about, they would have gotten good advice. And 99 or more times out of 100, that advice would have been get vaccinated, get boosted, and be protected.
I think for pregnant women in particular, it may not necessarily be a mistrust of their doctors. I know that when I was pregnant, I loved my physicians. I just wasn't sure about the vaccine and the effects it would have on my baby. And so I think with pregnant women, what we're worried about is this going to alter my baby for the rest of their life? I mean, we give up a lot of things being pregnant, right? We give up sushi, we give up caffeine. And so a vaccine is a big deal, and it's new. It was new at the beginning of the pandemic. And so I think with pregnant women, I haven't seen as much mistrust of doctors as I have seen just concern about their babies. And we do have a great number of patients that are pregnant and do get vaccinated, but not as much as non-pregnant women. And what we also see in our pregnant mamas who choose not to get vaccinated is that they'll get vaccinated immediately postpartum. So you know that it's in the back of their mind. We know that they're trying to protect their families and their children as best as they can. And what we recommend is that everybody makes a decision that they are comfortable with, but that they make an informed decision, that they speak to their physician and their healthcare team, and they come to that decision together.
Thank you both. The second question from Gabrielle Mays is for Mayor Johnson, just clarifying that 910 people have been vaccinated because of the latest city incentive program.
Yes, and thank you for asking that question to clarify. Yes, that's how many have been given out. Although, again, these incentive cards go out pretty quickly, so I wouldn't be surprised if we would have exhausted the entire supply already today. And had 1,000 of those that have gone out at this time.
Thank you, Mayor. Our next question comes from Melissa Zygowitz with CBS 58. She says, as cases continue to go down, there is more talk about lifting mask mandates in schools. Is now a good time for schools to start making them optional?
Well, as I mentioned, our trends are going in the right direction. Our positivity rates are still high, but they're dropping rapidly. So certainly I think it's time to start having these discussions. It may not be time to drop the masking requirements, but it's time to start the discussions. I think when to pull back on masking and distancing in schools or businesses or communities should be determined by objective, expert-derived metrics. And hopefully these metrics were developed much earlier in the pandemic. They're not being developed right now, but they were developed earlier. And they were adhered to throughout the pandemic. Allowing politics, fatigue, or loud voices to influence that process, I think can be full of risk and can be dangerous to the community.
Thank you. Our next question is also from Melissa. She says, you mentioned that 2 weeks from now, cases will likely go down even more. Why do you think cases are going down? And are we past the Omicron wave for good?
Good questions. I think cases, well, we know cases are going down by looking, but I think you mean what is causing the cases to go down. So I think it's multifactorial. One is certainly mitigation measures. If people don't distance, if people don't mask, there just is more spread of disease. We know that very clearly. A big part of it is certainly immunity. Vaccine-derived immunity, the safest way to get immunity, as well as infection-induced immunity. That certainly does provide some level of immunity, though in a much riskier way. And then there's just what we've seen with every variant, which is at some point, the variant burns through the population, the susceptible population, and those declines start to come. So I think we are seeing the end of the BA1 variant of Omicron, the original Omicron. I don't think that BA2 will have a terribly substantial impact on our community, since we're already seeing the downtrend. It may slow our downtrend, and it certainly may have effects on other communities that are not starting to see that downtrend from Omicron. But I think we're moving toward a good place. I think the question is going to be what comes next. We still have a lot of issues with vaccine equity globally that can develop more variants. And if those variants end up being more resistant to previous immunity or vaccine-induced immunity, or more severe or more transmissible, we may see more cases again in the future, but hopefully we'll start moving in a much better direction.
Thank you, Dr. Weston. Our next question comes from Caroline Reinwald with WISN 12. She's wondering, it's a data question, so if we don't have it available, we can always circle back offline, but she wants to know, do we know how many pregnant women or mothers in Milwaukee County are unvaccinated?
So in Milwaukee, we are aligned with the national average of about 40% of pregnant women are vaccinated. So we are pretty aligned with the nation in that.
Excellent. Thank you, Dr. Ali.
Yeah.
All right. Our next question comes from Lori Lanin with the Milwaukee Journal Sentinel. She says, on Thursday, the MPS school board will consider changing its 3% positivity threshold for closing schools, as well as the 10 to 14-day exclusion period for positive and exposed cases. Do you think it makes sense to make changes to these policies at this time?
Well, not talking about any specific school district, as I said before, I think having your policies be informed by experts, informed by clear guidelines, and being consistent with those guidelines moving forward is really important.
And the last question I'm seeing is for Mayor Johnson from Caroline Reinwald with WISN 12 about the Milwaukee mask mandate. She's wondering, are there considerations to revising the mandate?
Thank you, Caroline. As I said from the beginning, when this current mandate was brought forth, if trends with COVID continue to go in a positive direction, that it could always be reconsidered, be voted out again, and ended early. And so that is within the purview of the Common Council. That legislation would have to come here. And if the trends continue to go the way that they are, I'd be interested in reviewing that legislation. So potentially, yes, that could happen.
Thank you, Mayor Johnson. I'm just doing a quick review. I believe I captured all of the questions here. One more coming in from Spectrum News. What are the metrics for that, Mayor Johnson, in removing the mask mandate?
Well, as I have also said from the beginning in this, our decision should be informed by the health professionals, the experts on COVID-19. And so as our trends continue to head downward, I think that the Common Council as well as the health department will be in contact about if it's appropriate to remove it. And if that determination is made, then I'm happy to review that. I'm happy to review that when it comes to my desk.
Thank you, Mayor. Okay, we might have one more question here. Dr. Weston, a clarifying question. Are you able to talk about, are we past the peak of Omicron yet?
I would say we are past the peak of Omicron. We're seeing declines in cases, in positivity, in hospitalizations, and deaths. I would say we are past the peak of this Omicron variant.
Right. I believe those are all of the questions that I am receiving in the chat. So thank you all for joining. Thank you, Dr. Ali, for joining us today. We'll be here next week.
Thank you for having me.
Bye now.
Thanks, everyone.
Take care.